Welcome to Compassion Speaks, where we give a voice to the nonprofits in the community. I'm your host, Kevin Weaver, and today on our show we have Shasta Van Cleave. Ms. Shasta, welcome.
Thank you.
Today's show is a little bit different because we've got going a direction that we haven't in a long time. We're actually going to be changing the guard. I'm going to be hosting a different show that we'll be promoting soon here on Sholo TV, and Shasta is going to be taking over for me. So Shasta, welcome to the program and welcome to the hosting of the show.
Thank you. I'm excited for the opportunity.
Yeah, you know, really when I talked to Mel and the crew here about changing directions, they asked me if I had somebody in mind, and truthfully, you were my first choice.
Thank you.
Shasta and I have worked together now for how long?
11 years.
11 years. Isn't that amazing? So, you know, for this first segment, we're just going to be chit-chatting a little bit about our relationship, and Shasta's got some exciting ideas on different hosts that are different folks that she's going to be interviewing. We'll share them with you in a few minutes. But, you know, our personalities have clicked over the years, and I'll never forget, Shasta will never forget when she first came to work for us. I'm a bit of a comedian at work, and well, you just tell people what you thought of me when we first started working together.
I thought you were a complete clown.
Go with that.
But it's evolved.
That's right. Tell people
and
the
now
truth.
we know, Kevin, that you are like everyone's big brother.
Yeah.
Or maybe an annoying little brother.
An annoying little brother or big brother. But the point why I bring that up is because this program really is all about relationships in the community. And over the years, as relationships build, that's how we continue to promote a good, healthy, vibrant, and progressive community. And for those, well, you know, Shasta, you grew up in this area, didn't you?
I was born and raised here.
Born and raised. So you were born where?
Navapache Hospital.
Navapache. Where was it in those days?
And it was actually in Lakeside. The city limits were more to the north for Lakeside. So I was born in Lakeside, and my little brothers were born also in that same hospital, but their birth certificates say Sholo.
They say Sholo.
So.
Excellent. So we've got a real native that's taking over the reins. And speaking of reins, Shasta's history is rodeo queen and rodeo this and rodeo that. And matter of fact, I know some of the guests that she's going to have on in the months to follow are going to have a lot to do with rodeo and some of the different events that take place in the mountain. And you know, we want to you know, interview these people and keep you appraised of what's coming on as far as events in the community, so that we can participate, sponsor, and be a part of these events. That's how we grow healthy. That seems to be kind of the theme that's running through my mind this afternoon as we talk. And incidentally, I didn't say Happy New Year to you guys, and that's why the 4th of July looking balloons. And I know Shasta criticized my centerpiece and said, ooh, that's horrible. But it's my thing, and when she comes back in a few minutes, she can do her thing. And we certainly do want to welcome her. And so talk to us about some of the things that, and maybe the direction you can see this program going.
Well, Kevin, as you know, I have a heart for the elderly and also for children. So I really hope to talk with any nonprofit group in the White Mountains that works for the benefit of children or the elderly, and of course everything in between. But one reason I've always been so drawn to rodeo is what it does for the kids and the many programs and family-oriented activities for kids.
You know, and that makes a lot of sense. Really, the two areas of any community that really do need community support are our elders and our children. Of course, the elders, they've earned the respect, and they're leaving, and so we certainly have to honor them. And children, of course, they're our future. You know, folks of you who are tuned in today, we want you to begin to think about maybe calling in and offering ideas and suggestions for people that you know to be interviewed. When you think about children and elders, to me, in my mind, I often think about volunteers or people who work with these different areas of our population.
Well, volunteers make our world go around.
Yeah.
And we see volunteers doing wonderful things, you know, oftentimes in just a quiet way. But what they bring to someone in need is attention that's so badly needed.
Yeah.
And care. And so we want to bring attention to what they are doing
Absolutely.
for the community.
You know, and that's kind of the fine line. Compassion Speaks, of course, historically it's always been about uplifting and focusing on the not-for-profits, but those of you who volunteer, I think that fits within the parameters of what happens and what we want to promote on this program. So I encourage those of you who volunteer, maybe you're volunteering in different areas in the community that we're just not aware of. At the end of the program, Shasta's going to have her contact information up, and we'll ask you to contact her and bombard her with letters and phone calls and emails. Just let her know that you're out there. And so you do have, I just kind of wanted to, you know, kind of tickle the folks a little bit. In March, there's an event coming up, so maybe we can speak to that for just a minute.
Yes, there is a nonprofit directed by a wonderful lady named Mary Ann Yazzie, and the name of the nonprofit is the Talani Lake Team Roping Production. And it's an event that started out on the Navajo Reservation, and they outgrew their facilities, and they've moved the event to the Navajo County Fairgrounds in Holbrook. And their event is on the first weekend of March. And they have all kinds of different competitions, and they bring in world-class team ropers.
Oh, excellent, excellent.
And they also bring in competitions for the kids. And then they have Native American food and Native American dancers. And they raise money to benefit veterans programs, children's programs, and then also to support Native American team roping competitors. So it's really a big event in Holbrook, and it's just gaining momentum, and they are a nonprofit.
Excellent. So you folks will need to tune in back next month in February, and she'll have a few guests on that are going to be talking about that event. And I mean, that is exciting. I'm trying to become westernized. I've been here in Arizona since 1978. But I'm a New Yorker, and that's where I'm from. And you know, you talk about these different events. I call it barrel roping and barrel racing, all these things. There is a certain intrigue that I'm finding myself attracted to. And so, yeah, you guys come and get involved in this stuff. So what else do you have in mind?
Well, I would like to talk to children's groups. Of course, you had suggested the Little League, and then anything to do with any kind of arts and music. I would like to hear from those groups.
Head Start programs. There are programs that are out there that work with early intervention. And so all of you folks call and try to get on this list so that we can feature you and talk about it, what it is that you do here on the mountain.
Right, so it'll be one time a month. And we already have 2 or 3 months scheduled. So contact me and we'll get it on the schedule.
Excellent. So enough chit chat for now. You folks stay tuned. We're going to be back in just a couple of minutes. And when we do, Shasta will be sitting here and there'll be a different guest there. And so there'll be the changing of the guard. And so Shasta, on behalf of the folks that work here at Sholo TV, welcome. I'm excited for you. And for those of you who've been watching Compassion Speak and me as the host, be looking forward to a program that I'll be hosting, and we're going to bring a Grief Observed back, and I'm looking forward to hosting that program. And so you stay tuned, and we'll be right back with the next one.
Welcome back to Compassion Speaks. I'm your new host, Shasta Van Cleave, and joining us now on the show is Ron McArthur, CEO of Summit Healthcare.
Well, thank you for the invitation to join you today.
Thank you for coming, Ron. We're so excited about the expansion, and we're hoping that you can tell us a little bit more about it and how it will benefit the community.
You bet. 4 years ago, the board was very interested in acquiring the property next door to us, the Pine Shadows Mobile Home and RV Park. We contacted the owners and asked if we could have first right of refusal if they ever decided to sell it, because we were landlocked and needed room for expansion, and we got a call from the Chapman saying yes, they would like to sell it to us. And so we began negotiations back in 2015 to acquire the property. We acquired the property, some months later, and we operated the property as a Pine Shadows Mobile Home and RV Park for a couple of years. Following that, we engaged a company out of Colorado called NextCore Inc. to come in and do a master campus site development program to look at what that property could be used for, what's the best use, how it could complement the existing property. And following a 6-month study, they came back and recommended we should develop that property as an outpatient campus and construct 3 buildings on the property. And the board accepted their recommendations about a year ago, and then we've been in the planning stages of getting the mobile home park closed. We closed it a year ago, and it took us a full year to get all of the mobile homes moved off the property. We had to go to financing, a very complicated financing, because some of the bonds are taxable and some were tax exempt, so it took a little bit more lead time to get the financing done. But we completed the financing on October 31st, Halloween, and then we broke ground on November 6th with Western Grade doing the site preparation. And it'll be about 4 months of dirt work. It's about $4 million. That's not a very level piece of property. We're having to cut down a hill. We're going to have basically a 2-level campus there. The first level will be for our MOB, and then up on the back will be an ASC and an administrative services building. So it'll be 2 levels. The 3 buildings we're going to build there is the one that will benefit the patients the most is a combination outpatient services building, medical office building. Be a 3-story building, 105,000 square feet, 35,000 square feet of floor. First floor will be outpatient services, have pharmacy, lab, imaging, physical therapy, occupational therapy. Pools there for, physical therapy, wound care, almost anything that you'd need on an outpatient basis will be available on the first floor. The second floor will be for our medical and surgical specialists, and the third floor will be for our primary care physicians. And the footprint, they'll be as big as the tower in terms of the tower's 5 stories, 18,000 square feet of floor. This will be 3 stories, but will be double the size on each floor from 35 to 18,000 as compared to the tower.
Will this be done in phases? In other words, will one building be completed and go into use, and then the second building?
No, all the buildings are scheduled to go. So in addition to the medical office outpatient services, we're building a freestanding ambulatory surgery center and attaching it to the MOB. So the surgeons will be able to walk across through a covered walkway, do their surgeries, walk back to their offices. And then the third, and that ASC will be 16,000 square feet, 4 operating rooms, and 1 special procedures room. And it has the capacity to expand at a future date. And then the building back in the back will be what's called an administrative services building. Be 2 stories, 55,000 square feet. First floor will have a meeting room complex. We're out of meeting room space, and we'll be building a big enough meeting room to accommodate 200 people at a time. And then it'll be like a conference center where you can divide it up into different smaller rooms. We'll also be moving our materials management and environmental services out of their building and creating a new space for them. We're going to be relocating everybody on the 5th floor to the new administrative services building. So all of administration, all of HR, all of medical records. We'll also be consolidating accounting, business office, a bunch of other services. So a one-stop shop for a person coming to do something with administration will be in that new building. And then once we've moved, the 5th floor will be renovated to become a behavioral medicine floor. We're planning to open a 12-bed general psych unit January 1st, 2020. So the game plan is for the first 4 months of site preparation, which begin in November. We expect to have the site fully ready to construct by the end of February. We call that the horizontal site preparation. And then we begin the vertical, the actual building of the 3 buildings. And it will take about a year to build them. We're planning to move in the first quarter of 2019. And Hayden Construction got the contract as the general contractor, but they're contracting as much as possible with local subs to do the work. It's the biggest building project in the history of Show Low. When you look at our $45 million we're borrowing, NextCar's borrowing $30 million, and then we've already spent $4 million on acquiring the land. So it's about an $80 million building project, and the big benefit will be for the patients. The patients will have a one-stop shop. They'll be able to come see their physicians in one location, get their lab, x-ray, whatever they need while they're there. We're getting a special stoplight put in, so they'll be able to drive right into the medical office building, be able to get their care and leave. So it'll be very convenient for them, and it'll offer some economies of scale for our physician providers, because we'll be in one location and we'll get some big economies of scale. Instead of having 20 different clinics scattered all over town, they'll all be in one location.
Will there be any new services in the expansion that we currently do not have in the area?
The inpatient mental health services, we look to bring psychiatric services to the mountain, so there'll be outpatient and inpatient mental health. But the other services will be just consolidated, be made more convenient. As we bring new specialties to town, that may result in new services that are not currently offered.
And explain to us, Ron, what geropsych means.
Geropsych is geared for patients 55 and older. It's not gauged for, there's 3 levels of psychiatry. There's children, adolescents, and adults, so it's an adult psychiatric unit. It's going to be more geared to the Medicare age, the senior citizens. Medicare is a much better payer than Access or Medicaid, and Medicare patients aren't as hard on the facilities as adolescents, so they're a lot easier to manage, and it'll be nice to have them there with our medical patients as well. Our hospitalists will be able to cover both, and that patient tower will be like it was designed to be, all patients, rather than right now it's 4 floors of patients and 1 floor of administrative services. So,
can you tell us more about the pharmacy? What type of services will the pharmacy be able to offer, and what will the hours be?
It'll be a retail pharmacy, and it'll be tied to the hours of the medical office building. So I'm guessing 8 to 5, Monday through Friday. We'll also offer durable medical equipment services out of the pharmacy. It's designed to be a one-stop shop. So, if you need prescriptions, you'll be able to go to the first floor and get them on your way out the door.
Now, will that just be for patients seeing physicians in the building?
It'll also be for our employees as well. It'll be open to the public, and we'll be able to use the 340B pricing to help get the medications less expensive than what we could otherwise.
Okay, so that's a benefit for the community.
Be a benefit for the community as well, yes.
Now, you had used some acronyms earlier in the conversation. Explain to us, I think you had said MOB.
Medical Office Building is MOB. ASC is an Ambulatory Surgery Center.
Okay.
Administrative Services Building is Administrative Services.
And so plenty of parking?
Lots of parking, yes. There'll be parking. I can't remember how many, 300, I believe, new parking spaces are being added to the campus. I know there's been a lot of concern about the trees coming out, and we'll be planting 300 new trees as part of our landscaping project, and we want it to complement the hospital so that when you drive up to it, you'll think they were both built at the same time.
Okay.
And it'll be a campus concept. Basically, we're developing an outpatient campus to complement an inpatient campus, and put our best foot forward there on the White Mountain Boulevard.
Will any of the services be available 24 hours a day, or will it strictly be Monday through Friday?
Monday through Friday.
Okay.
It's you know, the emergency room will be next door at the hospital, and we'll still be doing inpatient 24/7, but outpatient will be just Monday through Friday, and then we'll still keep our 2 walk-in clinics, one down on the Deuce and one up in Pine Top for the weekends. So we'll still have urgent care centers open in addition to our ER for the weekends.
You talked about the board making this possible. Can you tell us who the members of the board are?
Yes, the members of the board, when we were first developing the project, our board chairman was Neil Thompson, and now our board chair is John Corder. John is our board chair, Dr. Becky Thompson is our vice chair, and Steve Garrett is our secretary treasurer. We also have Dr. Wright, a physician on our board, Dr. Sean Smithson as chief of staff. He's also a board member. And then we have Neil Thompson, as I mentioned, and then Paul Watson. So 7-member board, 4 lay members, and 3 physicians. And it's a community-owned, community-operated hospital, biggest employer in town. When I got here, we were about 600 employees. Now we're over 1,200. During the construction, we expect about 200 workers working on the project for the next year, and then we looked at about 100 new jobs once it's all said and done, so we'll be up in the 1,300 to 1,400 range of employees.
So you had mentioned that it should take about 4 years to get all of this done?
Oh no, we'll be opened. It started 4 years of planning.
4 years of planning, okay.
4 years of planning. It's going to take, we'll be open in 13 months.
Okay, so when the dust settles and that is open, what will be the next goal for Summit Healthcare?
Well, the next goal will be to have more people stay at home for healthcare. One of our biggest challenges is community members continue to drive to the valley for services, and we're hoping by having a new medical office building, more outpatient services, people will choose to stay home for care. Our goal is, as our mission statement states, trusted, deliver exceptional, compassionate care close to home, is to keep patients on the mountain for every service we're able to provide. And we had a new announcement today. The press release is going out. We were named as a CMS 5-star hospital. There's 82 hospitals in the state and only 6 are 5-star, and that's the highest ranking that CMS gives for quality of care. So we are ranked the highest in that, and this is a national score. It's just not a state score. So,
is part of that based upon patient satisfaction scores?
It's mostly patient quality of care, quality of outcomes, some patient satisfaction, but really heavily weighted to quality.
Have you found it difficult to receive back the information from the patients on the satisfaction? Oh
no. The government requires us to do a survey, and we survey all of our inpatient, outpatient, and physician clinic. But our goal is by adding all these new services is to keep more health care at home.
Are there certain specialists that you would hope to lure to our area and become a part of Summit Healthcare that maybe we don't have now?
In terms of the ones that we would like to recruit, we don't have as a full-time neurologist. We're looking to recruit a second pulmonologist. We have 2 new surgeons coming in the next 6 months. We have some of our orthopedic surgeons getting ready to retire, so we'd like to recruit them. But the specialty we don't have right now is neurology. Hadn't had it for 5 or 6 years. And then we look through telemedicine to bring some subspecialists, some infectious disease, rheumatology, endocrinology, those types of services that there's not enough patient volume to support full-time people, but to do it on a part-time basis with telemedicine equipment. So in that building, there'll be a place for people from the valley to come up and rent space and be able to offer part-time clinic services.
Okay. So of course we know about the Summit Healthcare buildings in the Show Low area. Can you tell us what services are offered in Holbrook and Heber-Overgaard? Yeah,
we have outreach clinics. Heber-Overgaard, we just opened a new clinic March the 13th over there. We have primary care services, have a physician and 2 what we call physician assistants, nurse practitioners. We also have specialists rotating through over there, and then we have telemedicine equipment so they can get consults from our specialists here in town with patients not having to drive back. Snowflake Taylor, we have 2 clinics in Snowflake. We have the Snowflake Taylor Clinic with our outpatient imaging services that opened a year ago. And then we have the original Snowflake Clinic that we acquired that about 6 years ago. Holbrook, we have 2 clinics in Holbrook, one at the High Desert Healthcare Clinic up on the Navajo County campus, and then we have a physical therapy building where we provide physical therapy services over at the old North Country building. And then last year, well, I guess 18 months ago, we acquired the biggest clinic over in Eager, the Hamlin Mountain Avenue Clinic, and has 3 providers in it. And we have another provider going to join it next summer. So we have a presence in Eager, Snowflake Taylor, Holbrook, and in, did I leave one out? Heber Overgaard. So, and then we have a good relationship with the IHS hospital down at White River. So we're kind of in the hub, and I call it the hub with the 4 spokes.
Okay.
We have clinics, primary care clinics, that feed inpatient admissions back to the mother house.
Okay. Well, congratulations, Mr.
Well, thank
McArthur,
you.
on all of the exciting developments.
Well, congratulate our board. They deserve the credit
Yes.
being the visionaries and wanting to acquire the land and expand our services. And it's going to be a really fun time to watch the building come up after 4 years of planning to make it happen. Now, when the dirt work's moving, and you know, we'll see the footings being poured in the next 3 to 4 weeks, and then when they start coming out of the ground, it will really get people's attention.
Well, we hope for a very smooth process.
Well, it'll be a great project for the community, and most of all, it'll benefit our patients. We always want to put patients first.
Yes. Thank you.
Thank you.
Thank you for joining us today, and tune in next month to hear Compassion Speak.